Willie, Kisumu DG, for an update. Kevin, I know this is some reprieve of some sort for those living with HIV, isn't it?
Well, as you put it, this is a lot of relief for those who live with the virus, especially in Kisumu County. Remember, this is the county number 2 after Homa Bay when it comes to matters HIV prevalence. So today, those who are living with the virus sighed a sigh of relief when at last the KEMSA management handed over ARV drugs worth 444 million rather, sorry for that, to the management of Kisumu County, and that was Dr. Matthew Zowili, who is the deputy governor. This is something that, of course, has grabbed the headlines for quite some time now, and especially given that because of the rationing, some of those who rely on these vital drugs resorted to really sparingly using them, not the way it is prescribed, so that they avoid the back and forth from the various facilities where they get their supplies. And of course, these experts had warned that would continue to the rise in the viral load, and of course the mother-to-child transmission of the virus, among other drastic effects when it comes to matters HIV. Hopefully, I'm here with Kisumu Deputy Governor Dr. Matthew Zowili, who was given, the drugs were handed over to him. But more than the drugs being handed over, there have been issues of the children lacking the ARV drugs. So the first question that I want to ask you, DG, is the ARVs we are talking about, is it only for the adults, or the children who have been equally badly affected by the shortage have also got their supplies?
Well, the unfortunate situation is that the children of Kenya, and especially the children of this region, I'm talking about 8 counties in number, are still not out of the woods yet, because, as you know, Caleta suspension is still out of stock. Caleta pellet is also still out of stock. To make matters worse, you know, even the diagnosis of this condition in the young ones is also an issue that you're talking about. But having said that, I think that there is good news, at least for the next 1 month, for the adult population who are suffering, not really suffering, living positively with this disease. Okay, you know that this region accounts for the highest population of those who are living with HIV. Kisumu at number 2 with 17.3% of all those who are affected. Of course, Homa Bay with more than 18%, actually 18.3%. So today we were, flagging off the distribution of ARV commodities to the 8 counties. I'm talking about Nyamira, Kisii, Migori, Homa Bay, Kisumu, Siaya, Kakamega, and Vihiga. So that basically was flagged off today. The governor of Kisumu, who is also the chair of the health committee at the Council of Governors, did express concern last week in his weekly address to the nation regarding COVID-19 situation, and he did call upon the national government to do what they can to ensure that the commodities reach the facilities so that those who are living positively with HIV can continue to get the care that they have been getting for some time. So that is basically what we are doing today, this morning, and we believe that by now in most of the facilities the drugs may already be there, because, as you know, Kisumu and the counties that have counted are not really very far apart.
Okay, and lastly, before I hand over, what has come out is the fear that comes with the rationing of drugs. And today I just wanted to go on record that what we have, those who've been taking for 3 months will be able to get that, or is the rationing still continuing?
Well, unfortunately, the rationing may continue with this distribution that we've done today. I think what we have is just enough to last each and every patient 1 month, okay? But as you know, Kevin, the situation in this country and in the world, I mean, is different now because of COVID-19. So I know that the national government, the Ministry of Health, the governor, really, through the COG, are working, 24/7 to ensure that the supplies are normalized. finalized, okay, so that within that 1 month we should have received the next, consignment. But allow me to say also on behalf of the governor that the Ministry of Health need to resolve the issue that is existing between that particular ministry and the USAID. We are aware of a consignment that is already in the country, but that has not been started, that they've not started distributing. Therein, we may get the help that we need, especially for the children of this country. I think they need it, and we need to work with speed and move with speed to resolve that, stalemate, if it is, so that those drugs can then get to the population where they are much needed.
Well, thank you very much for that important update and giving us more details on what happened this particular morning here, the flagging off of the consignment from KEMSA, the ARV drugs, to the various counties. Of course, Kisumu being the host to the regional distribution center. That is the much that we have from this end. Of course, it's clear from the leadership of this county, and I believe is echoing the voices of other leaders as well, that something needs to be done drastically so that by the time the supply gets depleted, then of course there will be something that those who are living the virus can rely on. Back to you in studio, Michelle.
All right, thank you very much, Kevin Ogutu, for that. Now back to Nairobi County. Hundreds of passengers using public transport were this morning inconvenienced during a trial run conducted by the Nairobi Metropolitan Services. The move is part of the larger NMS project that is aimed at decongesting the CBD. Our reporter Fred Kagonyi